The Metabolic Vulnerability Index is the most important lab test that you can get done. It's a blood test, and it's relatively inexpensive. My office charges $135 for it. I've done it twice now, January 13th of 2025 and then February 10th of 2025. My score dropped from 55 to 31. And what does this mean? It means that my chance of dying in the next 5 years has dropped significantly by about 17%. Let me show you. My first score was 55, so let's look right down here in this corner, 55 at that blue line. So let's go all the way across, straight across. That's a 20% cumulative mortality incidence. This has been run on 24,000 people at the National Institute of Health, and these people had conditions that caused their death, and they did the MVX score. And if their score was 55, then in 5 years, down here we got years 4, year 5, they had a 20% chance of dying. My score then dropped in 4 weeks to 31. Where is that? Look right here. There's 35 and less than 35. So we have to drop down right about there, go all the way across, and my mortality incidence now is about 2% or 3% over the next 5 years. I've run this on about 100 people so far, and the average score is in the 30s and 40s. I got plenty of people in their 50s and all the way up to 70. The best score is 15. The next best score is 23. Your goal is less than 35. Here's my old score from January 13th at 55, and then February 10th, 31. How did I get it down in 4 weeks? Well, I discovered the cause, and for me, it was a gas leak at my house. It was leaking for probably a year, maybe 2 years. And it was so bad that in May of 2024, I went to the ER with crushing chest pain, high blood pressure, difficulty breathing, left arm and left leg numbness. I started taking high doses of B1, and I was 95% better within 2 weeks. And it kept me going really well throughout the whole year. I found the gas leak December 7th. It's a toxicity issue that makes your MVX score go up. Let's look at these other numbers. So this number here says 335. That's for glyc A. I got it down to 316. Glyc A is inflammation and infection. So I got my glyc A down by 19 points in 4 weeks, and that's a significant improvement. And I did that by detoxing, basically, and solving the gas leak. The goal is between 260 and 300. I've seen patients whose scores are 400 and 500. And if somebody has a severe infection, such as the one that went worldwide in 2021, their score could be 800 and 900. Next to this small HDL particle number right here, my score was 11.7. My new score is 17.1. You want that to be 17, 18, or 19, because small HDL particles clear out LDL out of the blood. Now notice that in this test, there's no LDL measurement. It's the small HDL particles. That's what's important. Statin drugs do not lower your MVX score. The MVX test is the best way to determine how long you're going to live and what are your chances of surviving the next 5 years. LDL cholesterol is not one of the 6 factors. Cardiology needs to keep up with the latest technology and the newest labs, and that's what this test is. How do you get the small HDL particle number to be 17, 18, 19 where it should be? Well, it's a toxicity issue. I used to think it was a dietary issue. It's really a toxicity issue. Citrate is the next factor to look at. My first score was 1.94, and then my new score is 2.31. I used to think that below 2.0 is ideal, but really the difference between these two scores is irrelevant because they're both really good, and they measure mitochondrial function. If your mitochondria are not working very well, your scores go up severely into the teens, 20s, and 30s. So if your score is 2.0 and then next time is 2.1 or 1.9, it doesn't really mean much. But if it's higher, it means your mitochondria are not working very well and you really need to detox. So there's 2 things that indicate detoxification. One is small HDL particle number, and the other one is citrate. They both indicate the need for detoxing heavy metals and chemicals. And as a reminder, the glyc A is for detoxing in organisms and reducing inflammation. You have to do all this naturally. Drugs do not lower your MVX number. The last 3 things to talk about are valine, leucine, and isoleucine. These are branched-chain amino acids. And my scores over on this side are decent, and then they all come up on this side. I restarted vitamin B1 because that lowers these numbers over here. The scary part is when these numbers are extremely low. And I have several results of about 5 or 6 people whose MVX scores show very low branched chain amino acids, the valine, leucine, and isoleucine. And that means maybe they have some severe digestive issue where they can't digest their protein very well. They can't absorb protein. Maybe they're not eating enough protein. Maybe they're malnourished because they have dentures. They can't eat meat, and they can only eat peanut butter or protein powders. Or they have some severe disease, like cancer, for example, and they're malnourished. And that's this right here. It says metabolic malnutrition index. So my score was 59. You want that to come down. And in 4 weeks, I brought it down to 47 because I removed myself from this environment of this gas leak. In 4 weeks from this last test, I'm going to redo my MVX. And in the meantime, I'm doing a hardcore sauna detox program, 3 weeks long, 4.5 hours in the sauna with high doses of niacin to get that flushing and toxins come out through your skin. I'm doing that right now. I already feel better. I'm on day 6. When I redo the MVX score, chances are it's going to be even lower, and I'll let you know how it goes. Today, I just talked with a wonderful researcher at LabCorp, and she runs clinical tests at Duke and at UNC, and they're trying to get the MVX score to come down on people, and they're not successful. And when I told her on the phone that my score dropped from 55 to 31 in 4 weeks, she was completely blown away by that. And they told her my story about the gas leak and, repairing from that and detoxing. And she wanted to learn more and more. And I told her in my career that I figured out the 7-step blueprint to optimal health, and it lines up exactly with the MVX 6 factors. So they ran a clinical test with older men who had high glucose and insulin resistance, and they got them exercising. Their glucose got better, and their insulin resistance got better, but their MVX score did not lower. And I told her, well, yeah, that makes sense because exercise is not in my 7-step blueprint to optimal health. These are the 7 steps that match up with MVX, one for one. This is how you reverse chronic disease. This is how you prevent cachexia, which is the wasting away as people get older and older. The bulk of this is detoxification. So we're talking steps 3, 4, 5, 6, and 7 is all cleaning the body out. Exercise is not part of that. Eating a really good diet is step 1 right here. And taking minerals, for example, is step O, optimization over here. That's where you're adding nutrients in the first step and the last step. But the rest of this is detoxification. So in order to reverse MVX, you have to detoxify. She really enjoyed our conversation, and she wanted to learn more from me. And she told me that they noticed that statin drugs to lower cholesterol did not lower MVX. And I can guarantee you no drug will lower your MVX score except for the drugs that detoxify heavy metals out of your body. And maybe some antiparasitic medications, maybe a few antiviral, antibacterial, anti-candida medications. But it's the supplements that do a really good job of detoxifying the body and is the basis of reversing your chronic illness and by using these 7 steps. Supplements work really well here. So this kind of information needs to be forwarded over to RFK Jr. and Dr. Berg and Nina Teicholz. I know they're working with RFK Jr. right now to change the health landscape of our country. But this test is the report card or the grade card of how well you're doing and your medical doctor's doing on improving your health. Having said that statins don't lower the MVX score debunks basically all of cardiology. And there are other professions that will be debunked because the MVX score does not decrease when they give you their therapies. It has been my 25 plus career of figuring out how to reverse chronic illness, and my 7-step blueprint gives you the exact blueprint it takes to lower your MVX score. So I have about 100 samples right here of different people's results on MVX. Some of these are patients, some are not. I have everybody's phone number. I might give you a call and ask you how your diet is, how's your health. And if you want to get this test, you can order it from the front page of my website. Just go to the front page, upper right corner, it says MVX test. Click on that. There's a form to fill out. My office will contact you. The charge is $135. Or you could try to get your doctor to order this test. This test is through Professional Co-op, and it's number 123601. There's over 1 million doctors in the United States. I need at least 10,000 doctors ordering this test. So maybe you can convince your doctor to get an account with Professional Co-op and order MVX number 123601. Now there's a lot of details to know about how to lower the score, And with this video, I just gave you some very simple answers without much detail at all. But I have, 600 videos on YouTube. I've made 1,000 videos on social media. I have 5 or 6 courses. I got 3 ebooks. I got a regular book on Amazon Kindle. And you can learn on your own. And you can also become a patient in my office. And we can walk you through this process of cleaning your body out, getting the parasites out. And if you have mold, candida, virus, getting those out, cleaning up your diet, detoxing metals and chemicals. It's work, and it can be 6 months to 2 years. I personally detoxed mold for 7 years. So everybody has a certain state of health. You want to maintain good health. You want to improve bad health. And this is one of the best tools to measure your status of your health. Please subscribe to my channel, and I'll update you more about MVX as I learn more.